Good morning. You're listening to Insurance Matchmaking, your path to health, life, and Medicare coverage with Matt Libby Insurance. And now, sharing his knowledge, here's your host, Matt Libby.
Good morning. Welcome back to Insurance Matchmaking. I'm here by myself today. Last couple of weeks, Elijah's been with me. Just working on things to come up with some ideas to get some of these things out to people. This one's just, it's not going to seem timely, but I still think it makes sense and just, as people are doing their planning, because I'm actually going to be kind of addressing things for the annual election period, the annual enrollment period for Medicare. I love using my chat GPT because sometimes it just kind of gives me some ideas and to kind of cover. And I don't think I've really covered this one, at least not from this point of view. In the title of for the program here is When Not to Switch Plans During Annual Enrollment. Because a lot of people, kind of have that idea, well, it's that time of year we have to change plans. And that kind of applies to the healthcare marketplace too, but I always try to stress that, yes, you still should review, even if if you think you're not going to change. And what happens, though, a lot of times, and then again, maybe you do need to change, and maybe I'm getting a little ahead of myself here. You don't just have to look for another plan because it's open enrollment season. The plan you have may be perfect for next year, and I'm careful, being cautious of using the word perfect. But for you, it fits perfectly for you. We're not supposed to say one's better or best, so perfect is kind of a superlative. So we try to avoid those terms. But one of the things one of the biggest considerations on any health plan is your doctor in network. I've had some people pick plans because of the affordability that their doctor wasn't in network, but they only went to that doctor maybe twice a year. The doctor would accept a cash pay. Well, the cash pay for those couple times a year was less than the increase in monthly premium to have that doctor be in network. So it just made sense to go with the one that was going to be, hey, the doctor's not in network, but the doctor will still see you. But instead of having a $0 or $10 or $20 copay, you had to pay $75 or $90 for that doctor visit. Well, if you're saving $125 or $150 on your monthly premium, it's not going to kill you to pay $90 to $150 to see your doctor. So those are some considerations, but we generally try to make sure that we find a plan that all your doctors take. And especially with Medicare Advantage plans, that's not always easy, especially if you have a lot of doctors. If you have a cardiologist, a urologist, an oncologist, they very likely one of those doctors is not going to be in network. I've got a client in Kentucky. We go through this every year because he'll have a plan. He really likes the plan, but the eye doctor doesn't take it. Or he really likes the plan, and the doctor that gives him shots twice a year in his back for pain management is not in network with him. So we have to make sure. So we try to do the best to find the plan that either most of them take or find a plan that all the doctors are in network. So that's a big deal. And you get the bells and whistles. You call those numbers that say call here and get the food card or get $500 gift card for picking this plan, and call this number to get a free weekend in the Smokies. And next thing you know, you get stuff in the mail and you've switched your Medicare plan or your health plan and didn't even realize it. So be cautious of, the old saying, there's no such thing as a free lunch. If it sounds too good to be true, it probably is. So be cautious on those things. But a lot of times people they'll switch plans because it has, I've learned to kind of use the Part B give back plans. Some of them work very well for some people, and some people know you need to stay with the plan you have because of the higher copays and higher out of pocket. So it can go both ways. I've kind of changed my attitude on some of those because it's actually, you can use that give back to actually get plans that give you better coverage. So, and that's a subject for another show. That's why some people switch, because I'm going to get this extra benefit. I constantly have people call me like right after the enrollment period and say, "Hey, I got this thing in the mail." I said, "Throw it away." It's just, I said, should I call this number? No, absolutely do not call that number. It's those come-ons that they're going to offer. And the thing is, they may be offering you a legit benefit or product, but the cost to get that may be too high because, like I said, you lose your doctors or your prescriptions aren't covered well. That's the other thing too. And that's probably the biggest one right now. After the Inflation Reduction Act, it's just benefits are shrinking, and so it really makes sense to at least look over that. And we have a real simple process, especially those on a Medicare with a Part D. We use this tool, called Retire Flow. We send you a link. You put in your prescriptions, your preferred doctors, and you sign the infamous scope of appointment that Medicare says I have to have before I present you with options for your Medicare. And it comes very handy for us. Well, we can take especially that list of prescriptions, and plug that in either Medicare.gov or one of our search engines that we use in our enrollment tools, and we can search and say and figure out, hey, is your plan still covering it? Oh, and I always tell everybody, around September, be watching for your ANOC, your Annual Notice of Change. If you have any kind of Medicare plan, Part D plan or Medicare Advantage plan, they have to send that out to you in September every year. Now, unfortunately, a lot of times it's going to look like junk mail. So that's one of the things you have to watch. But it will have the logo of your insurance company on it. So, yes, you're going to get advertisements to maybe pick another plan from your insurance company. So a lot of that stuff, yes, you're going to toss that in the trash or the recycling. But double check to make sure it's not that Annual Notice of Change. It should come in an envelope. I've seen them sometimes. They're those ones, they're kind of like they just fold a little booklet together and then they put a sticky label over it to hold it closed and mail it to you that way without putting it in an envelope. But it's not going to be just a postcard. So generally, if it comes in postcard form, that's going to be advertisement, and you probably could toss that. I touched a little bit about prescriptions here. Is saying, when your prescription costs are already optimized. If your plan, like I said, if your plan's covering all your prescriptions. But we do need to double check. That's what I'm saying. We want to do a review and double check and make sure that your plan is going to continue to cover all your prescriptions, because that's one of the issues with that $2,100 max out of pocket on Part D is if it's not on your insurance plan's formulary, it doesn't count towards that $2,100 max out of pocket. And usually you'll spend more than that on that drug if you get it. And that's why, we refer things like the Canadian Med Store. There's other savings plans that we can help you with. So, and again, I've said this just in the last week or two, it doesn't have to be us, but please talk to a local agent. Don't just call an 800 number. And you may get somebody very good, but they're still not going to be as knowledgeable of what works in our area as we are, because we're here and we know the doctor's offices, we know the pharmacies, we know these plans very well. But, you could talk to somebody in Arkansas and they may know our plans very well, but again, they're working at it as a foreigner. Don't mean that to be a totally derogatory term, but I call myself a foreigner when I'm working, if I'm working with people in Kentucky. I know the plans fairly well because I've worked with Tennessee and Kentucky for years, but there's different nuances, and when you get into different metro areas, things are going to be different. We do it here. I'm not real familiar with everything in the Memphis area. Yes, it's Tennessee. The plans are going to be similar to plans in other parts of the state, but the market, the doctor's office, the hospital groups, I'm not as familiar with those hospital groups as I am with the ones in East Tennessee and here in the Upper Cumberland. So even if it's Tennessee, I may not be as well versed as somebody that might be a local agent there. So somebody in Memphis should probably find somebody who's a local agent in Memphis. I do have clients in the Lexington and Louisville area, and those two cities have very different networks, and so it really makes a difference. I'm trying to remember. I can't remember when I was doing a lot of Kentucky. Is the two main plans when I was working in Kentucky, back in the day when I would actually travel to meet with people in Kentucky was Anthem, which is a Blue Cross company, and Humana. Those were the two main ones. And one was much stronger in Lexington, and one was much stronger in Louisville. And I can't remember which one was which, so I think it's safe to say the company names in that case. But I always felt it ironic, too, that, with Humana in their headquarters being in Kentucky, and there was areas where Anthem was much stronger solutions. Kind of like you'd think they'd be covering their own backyard, but it's just the nature of the beast. The insurance plans, they negotiate with hospital groups and medical groups, and so sometimes they're just not as strong in one community as they are in another. I'm reading over some of these notes. I printed this thing out from ChatGPT, so I'm still kind of going through it actually, that it's like, the cheapest, and you've heard me say this or something very similar to this, is the cheapest premium plan is often the most expensive at the pharmacy, because there are zero premium drug plans out there, but they're not necessarily your best option. And this here is not really an annual election kind of period, because this would be something that maybe if you're changing plans in mid-year because you could, is when you've already hit your deductibles. I run into that more when I talk to people who are maybe they're leaving an employer plan and they're looking to go to the marketplace, but they're offered COBRA. Now, of course, if anybody who's ever experienced going from an employer plan to COBRA is very expensive. It's like going to the marketplace without having any subsidies. So what the main difference there is, remember, your employer is subsidizing your health plan, and also if you're one of the older employees, you're getting a break because the younger people are paying the same thing as you are. And when you go on COBRA, you're paying what the full rate is for your plan. So your age is now taken into consideration on that cost, versus when you're on an employer plan, everybody's paying the same based on their status of whether single, couple, family, whatever. So when you leave that employer plan, staying with that COBRA could really make a lot of sense. Maybe you had a surgery and you got some really expensive drugs. You've hit your deductible, maybe even close to hitting your max out of pocket. Yes, it might make sense to keep that COBRA plan at least until the annual enrollment period, or the open enrollment as we call it for the ACA marketplace, because depending, plus, you left the job, you might have been fairly well paid, but the next year your income is not going to be where it was this year. Maybe you're kind of semi-retired, but you're not 65, but maybe retired and started Social Security early, and your Social Security is not going to be what you were making at your job where you had that employer insurance. Now you're going to probably get a very good tax deduction, tax subsidy for your health care plan in January. So that's one of those times of sometimes it doesn't make sense to switch to the marketplace when you leave employer coverage, say, in the middle of the year. Now, when you move from one state to another, or one part of the state to the other, that if COBRA's not available or you're not hitting those max out of pockets, it's definitely probably going to make sense to look at the marketplace, depending on your income. We did lose those enhanced subsidies this year, so that's an issue. All right, well, we're up on the commercial break here, and we'll talk some more when I come back.
Hi, this is Marvin Long with Twin Lakes. What if your first year of wireless was free? Not a trick, not the fine print, just free. Bundle Twin Lakes gig speed fiber internet with Tri-Lite Mobile, and your first line is on us for the first year. You get blazing fast internet at home and crystal clear wireless wherever you roam. All from the team keeping the Upper Cumberland connected for 75 years. One company, zero hassle. Visit twinlakes.net or call 800-644-8582 to get started today.
First line offer requires Twin Lakes Internet service. Other terms apply. See twinlakes.net for details.
Join Habitat Restore at their pop-up donation event every second Saturday of each month at First National Bank in Sparta. The Habitat team will be there ready to go to receive your donations. So don't miss an opportunity to declutter and make a difference at First National Bank in Sparta with the Habitat Restore pop-up donation event every second Saturday of the month.
And now, back to Insurance Matchmaking with Matt Libby Insurance.
All right, and we're back, and I was talking about whether you switch with a COBRA or don't switch because you met your deductible. Of course, those deductibles are going to reset in January, so this is not really a open enrollment topic, but that middle of the year. The other thing is, when you're chasing that zero premium, I mentioned that, there is a zero premium drug plan, but that's not the best plan for everybody. If you got some expensive prescriptions, it may not be, or moderately expensive. If you have real expensive drugs, that zero plan might be the best thing for you as long as everything's covered on it, because you're going to hit that $2,100 max. And if you're going to hit it there, you're going to hit it on any other plan. So if you're not paying a premium and you've already hit the max, that plan could be affordable for you. You don't have to have an expensive plan. Some people will get a more expensive plan to have a lower or no deductible on their drug plan. But if you're going to hit that max out of pocket anyway, it might make sense to just go with the lower premium and go from there. So, and again, that's why you use an agent. If you've listened to my program for a while, I talked about how it was not this year, but last year, there was a $27 plan and a $97 plan. And I had several clients that took the $97 plan because it saved them several $100s over the year versus that $27 plan. So that $27 plan was very good for people who had moderately expensive drugs. But if you were going to hit the maximum out of pocket, and the nice thing at that time, the $95 plan had no deductible on the brand name. So you just had a copay, and then you hit that, and you were credited like with paying the at that time $590 Part D deductible. So that you already pay. So you were, just by getting the plan, you were already $590 towards that, and at that time $2,000 maximum. So don't just change zero premium plans. And like I mentioned earlier, the give back plans. If you're going to be using your plan a lot, you have a lot of medical issues, then that Part B give back may work against you because your copays and your max out of pocket on those plans are going to be higher. You're also generally giving up some of the other benefits. You may have little or no over-the-counter benefit, little or no dental coverage. So you really have to, if you're looking for extra benefits or you want the extra benefits, the give back plan may not be the best fit for you. It'll put more money in your pocket, but you may spend it elsewhere. Now you have to buy a dental plan to have dental coverage, and you just basically are you're taking the money you're getting for the give back and buying a dental plan versus taking a plan that had richer dental might have been better for you. So that's some of those things that we go over with you and help you figure out. We're going to give you our recommendation. And one of the things I was talking about during the break, some of the people call, I got this in the mail, I saw this commercial on TV, somebody called me, and I'm like, they're offering you something. If it was a good fit for you or you were eligible for it, do you really think I wouldn't have mentioned it to you? That's the question I want to ask sometimes. So I'm putting it out there blanket. So if this applies to you, and again, I may not be your agent, but if you're calling, you have another agent, you're calling them saying, hey, I see these ads. We know those. Actually, I don't really necessarily see all those ads, but we know just from what you say kind of how that's steering you. And most of those deals are you're going to have to call an 800 number. And I say 800, toll-free number. And you're calling into a call center who's someone and you end up talking to someone whose main purpose is to switch your Medicare Advantage plan or enroll you on a Medicare Advantage plan. That's the one that gets some people in trouble too, especially our older members. I had talked to somebody one time, got chewed out by a son or daughter, I don't remember now, it was but adult child, because I'd called the man, I didn't switch his plan, and I explained to him, I was just calling back because he called in to our number, and I was trying to figure out, because the guy had Alzheimer's, and it's like, how was he calling? And then I watched one of those commercials, and in big numbers across, a quarter of the screen is that toll-free number, always present. Dad had and I'm pretty sure it was a cordless phone, not a cell phone. Because at least with cell phones, if you got something like that, you can kind of set it they can only call certain people or can't receive calls from people. He was able to receive my call when I called him, and it was, yes, they're mild cases of dementia, but they're still kind of able to function on their own. Maybe they're living with that adult child, and they're sitting there in that recliner, and I've used this example. They're sitting in the recliner, they're watching Little House on the Prairie, Gunsmoke, Wagon Train, Mannix, Matlock, all those old shows that boomers like me enjoyed watching when we were in our 20s and 30s, and now they're on was it MeTV, and I can't think of the name of the different networks. But those networks all have commercials, and those commercials come out, and seniors watching them are bombarded with these Medicare come on commercials. They're really if they aren't, they're definitely borderline bait and switch. Most of them are going to be, they are offering what they're selling, but what they're really selling is getting you on another Advantage plan. And these call centers, a lot of them, they're incentivized by how many policies they add, and they get money up front. And then that person calls another 800 number a couple months later, and somehow they hoodwink or they cheat the system, and they get them a special enrollment code, and they switch their plan again, and it's a bunch of churn. And if you watch any of this stuff, and it may just sometimes just be in your news feed, but things be like on C-SPAN when the senators or congressmen are drilling people in the health insurance field, or they're discussing the marketplace for Medicare, and they're talking about the broker, and they talk about all this churning, and they talk about how terrible it is. It's like, it's not guys like me. I mean, yes, to a small extent, yes, we are, but it's those big call centers, like I said, they have that goal to just switch you. They're not looking out for your best interest. They're looking out for their best interest. And I tell people, I kind of take the Boy Scout approach: leave it better than you found it. You don't know how many times I have told people, I would love to have your business, but you really just need to keep what you have. That's what's right for you. And I can sleep at night without feeling guilty that I've switched somebody just to get a paycheck. Now, granted, if I can find something that makes sense for you, yes, I'm going to recommend it, because that is how I earn my living. But I'm not going to high pressure you. I had met with a couple yesterday, and it's one of those situations where one spouse is turning 65, the other one is still working and will stay on the company employer plan, but they can keep their spouse on their dental and vision plan. And I always tell everybody that I talk to that maybe they're going to switch from employer coverage to go on Medicare, or the spouse is going to leave the employer coverage because they can get it for a lot less on the marketplace, but the employee needs to keep with that plan. They can still cover their spouse for the dental and vision, but not pay the hundreds of dollars a month for the health care. And I tell them, by all means, if you can cover your spouse with your plan for their dental and vision, do it. I cannot compete with those rates. The rates you get on a dental or vision plan through your employer are probably half, or maybe even less than half, of what the dental and vision plans that I can offer. So I always tell people, yes, if you can keep that plan, by all means do. I mean, I've ran into people on cancer plans. And as I said, I started in the business. If you know my history a little bit, I started in the business with Aflac. So I know how Aflac plans work. Aflac has a cancer plan that is a treatment plan. Its main thing it's going to pay out is if you go and have a surgery, you go and get chemo, you go and get certain treatments and things, it's going to pay you on that. And they're generally very inexpensive, especially you've got it when you were younger, so you paid a lower rate. It was on payroll deductions, so it was very low. But you left that employer, but as long as you keep making the premium, you can keep the plan. And I tell people, I'm not trying to replace that plan. You've got good coverage there, but the way things work with Medicare and even, the Affordable Care Act, I recommend going with a plan that's a lump sum cancer plan. It's going to pay you thousands of dollars because you were diagnosed with breast cancer or colon cancer. I want you to have that money and use it the way you see fit, not have to file a claim every couple of weeks when your world has come crashing down on you because you got that terrible diagnosis. And as most people know, especially if you've gone through it or had a loved one go through it, going through chemo every couple of weeks is just a rough time in especially if you're single, are you really wanting to try to figure out to file claims for each time you get treatment? Or would it be a lot easier of, oh, you got diagnosed, you submit that pathology report to your insurance company, and they send you a nice big check. And then you've got the check to cover your max out-of-pocket. You've got money to cover travel for your treatment or to try experimental things. There's some things, I'm getting used to using a phrase, is non-Medicare approved expenses. And that applies to medical things. But travel is one of those things, definitely not covered by Medicare. Experimental treatment's not. If you have a Medicare Advantage plan, the doctor, the oncologist, or the clinic you want to go to because you've heard all the great results they get, they're not in network with your plan. So that's where these plans, and for pennies a day, as they say, pennies, $1 a day can get you $12,000 to $15,000 of cancer coverage, depending on your age. Now, of course, if you're over 70, it may be less than $10,000, for $1 a day, but it's still very affordable. That's one of those things to kind of. So I talked about, in that, the TV commercials, the mailers, you got a lot of those things. They're going to try to sway you to go to their plan, call that number. And like I said, I've got clients that call me, and I'm glad they call me first because now I don't have to go back and try to fix something that happened because they did call a toll-free number. So, yes, you're going to see the ads. And like I said, some of them are legit, but it still doesn't mean it's right for you. That's the thing. And that's where your agent, whether it's me or Elijah, one of my agents in my office, it's going to be, we know your plans. We're going to let you know. I get a kick of people will call in and Amy will answer the phone and she'll be talking and she's like, did Matt send it to you? It's kind of like, if Matt didn't send it to you, you probably can ignore it. It's like, if it doesn't come from me or it didn't come from your insurance company, you more than likely ignore it. I mean, again, I use Anthem, I use Blue Cross and Humana. If you get something from Humana, but you have a Blue Cross plan, that's gonna be an advertisement. If it's not coming from the current carrier you're with, it's going to be an advertisement. By all means, you're more than welcome to read it, look it over. It may stimulate some questions, and that's when I say, but don't call the number on the card. Call me and say, hey, I got this letter in the mail from this carrier or that carrier, and they're talking about this. And I'm like, oh, yes, that's something. We didn't talk about that when we did your annual review during the annual. Let's take a look at that this fall and see if that makes sense to switch that. Now, I think we just ended what they call the Medicare Advantage open enrollment period. That ended yesterday as I'm recording this. I'm here on April Fool's Day to record this. But the annual open enrollment period, as they call it, and it only applies to you if you have a Medicare Advantage plan. You could switch plans during this time, but you had till March 31st to do it. Because of the ice storms and such we had earlier in the year, we did get a disaster, SEP as we call it, a special enrollment period, and they said that was going to go to the end of April. And to be able to use that is you had to have a valid enrollment period that you didn't take advantage of. So in my mind, that extends our open enrollment for one more month. So if you're really not happy with your Medicare Advantage plan, maybe you found out after getting it your doctor left the network, or you didn't realize a certain copay was going to be what it was, or it doesn't have your dental coverage or over-the-counter coverage that you thought that you had last year. It's like, so maybe you want to look at another plan. Now, I do caution you, if you've had medical expenses, significant medical expenses, on the medical side of a Medicare Advantage, your max out-of-pocket will start over. So again, it goes back to that, whether you're going COBRA or not. So it might not be the right time to switch that plan, and I have gone over. So anyway, keep listening here, and remember, we don't sell insurance policies, we match them to you. So we'll talk to you next week.
You've been listening to Insurance Matchmaking with Matt Libby, your path to health, life, and Medicare coverage with Matt Libby Insurance.